is Barriers of PCV Implementation in Children. And first of all, I'd like to thank my good friend Dr. Ping-Ying Lee, the current and third president of the Asian Strategic Alliance for Pneumococcal Disease Prevention, or ASAP, for this opportunity. ASAP was formally established in December of 2007 in Seoul, Korea, after almost a year of discussions and meetings with pediatric leaders in the Asia Pacific. Its main goals were to raise awareness on the burden of pneumococcal disease and provide updates for our healthcare workers and policymakers to reduce this burden. We were fortunate to learn from each other and share issues with various pediatricians, including Dr. Iqbal Memon from Pakistan. We worked together and engaged with other healthcare workers to control and prevent pneumococcal disease, as well as other vaccine-preventable diseases in the region. I am grateful to all our colleagues who never get tired of coming together to help each other, as we are now doing even in this time of pandemic. This is my disclosure. I've been doing various epidemiological studies and vaccine trials in the last 30 years. I've also done some work with WHO and the Bill and Melinda Gates Foundation. Please take a look now at our region to remind us that pneumonia still remains as the top killer of children, with 15 countries...
Sorry, Bravo, your slides is not moving.
Okay, can you hear me now? I'm on my third slide, or is it fourth slide now? And I would just want to say that infectious... Can you hear me?
Hello, Lulu. Nice to see you again. You can begin.
Yeah, can you hear me now?
Yes, nice and clearly.
Okay, so yeah. I just wanted to say that many countries, especially in Asia, have actually been contributing to the pneumonia deaths, as Dr. Memon has said, and mainly India, Pakistan, China, Bangladesh, Indonesia, Philippines, Myanmar, and Vietnam, and the rest are in Africa, are contributing to the deaths in pneumonia in children. And this is my fourth slide, and we know that infectious disease experts rely on vaccines as one of the most cost-effective measures to reduce communicable and infectious diseases. The history of vaccination in the last 200 years have proven this to be so. Achievement of the Millennium Development Goals of 4 in 2015 and in many countries was brought about mainly by vaccines and provision of clean water. We see that even before the COVID-19 struck, much of the world still needed to improve vaccine coverage for the primary essential vaccines, including DPT, measles, polio. Unfortunately, Southeast Asia and Western Pacific countries, as well as Africa, have stayed stagnant in vaccine coverage in the last decade from 2010. See the blue for Africa and the red for South Asia and the yellow for the Western Pacific. This accounts for most of the 9.4 million children under-vaccinated or unvaccinated in the world, as this report from UNICEF shows. 10 countries actually account for 62% of children remaining unvaccinated or under-vaccinated. 4 are in Asia, namely India, Pakistan, Indonesia, and Philippines. Now we see Asian countries are failing with regards to PCV implementation. PCV is a vaccine that is recommended by WHO as part of the comprehensive approach to reduce the burden of pneumonia in children. Other measures are important in the control and prevention of pneumonia, such as nutrition, hand washing, indoor pollution, smoking, and early antibiotic treatment. Needed vaccines to prevent pneumonia in children under 5 are Hib, pertussis, measles, and PCV. The first are already included as essential for all countries in the last decade. We are concerned that the introduction of PCV may not have been given the full attention that it deserves. Now we applaud Pakistan, Dr. Memon, when it introduced PCV in their national immunization program as early as 2010, the first Asian developing country to do so, with Gavi's support. But it was actually Hong Kong in 2008 who first did it, with Dr. Chok Wan Chan supporting it. He was the leader of the Hong Kong Pediatric Society and was then president of the International Pediatric Association and founding member of ASAP. Other countries like the Philippines introduced it subnationally in 2012, and Singapore allocated funds from child entitlements for PCV at about this time. Other countries like Malaysia and Thailand have formed various advocacy groups to pressure the government to do it. Were they successful? We will see. In the rest of the world, we see the blue and dark blue colors shown in Americas and the Americas and Africa, beating Asia in the coverage for PCV. It is indeed lamentable that in 2016, we see Asia lagging behind Latin America and Africa in PCV coverage. However, looking at this chart, we see that in 2016, 3 Asian countries were set to introduce PCV. These were Bangladesh, Myanmar, and Nepal, somehow with Gavi's support again. We realized that the low-middle income countries have been disadvantaged by this development because they are left on their own resources, not being Gavi-eligible countries. In 2017, several countries colored yellow here, and that is India, planned to introduce PCV in its national immunization program. We see here the predominant green color of countries, mostly in Africa, Americas, and Europe, where PCV has been introduced, again emphasizing the stark contrast with that of Asian countries. Fast forward, in May 2018, Dr. Ping-Ing Lee convened the ASAP meeting in Taiwan to come up with recommendations that our pediatric leaders can bring to policymakers and the public in general. There was an intensive and comprehensive discussion and updates on studies on pneumococcal disease and the impact of vaccination. The outcome of this meeting is summarized in this slide. The recommendation, as stated, are the following. First, routine administration of pneumococcal conjugate vaccine is recommended for all children aged 6 weeks to 59 months. Second, all PCVs are effective and safe, and the committee does not express a preference for any particular vaccine. Third, PCV use is cost-effective in preventing pneumococcal disease in Asia-Pacific countries in both low to middle income. Fourth, inclusion of PCV in the national immunization schedule is the best way to achieve optimal coverage that is essential for maximum protection of children against pneumococcal disease. Take note that no new country in Asia has introduced PCV as seen in this slide. Why is this so? We see here that most of the Asian countries were still struggling to address specific challenges to increase routine immunization and how immunization can be scaled up. These challenges include inadequate access to immunization services, inadequate capacity at the district level for using data for action, especially needing surveillance, insufficient efforts to capitalize on the opportunities and available resources, especially Gavi support. And fourth, inadequate managerial capacity for monitoring and supervising immunization programs and lack of proactive communication planning. So before introducing a new vaccine like PCV, there needs to be solutions and strategies to be implemented to strengthen vaccination in low-middle income countries. And this include increased immunization coverage, eradicating polio and eliminating measles from the region, strengthening vaccine-preventable diseases, and increasing surveillance and laboratory capacity. Fourth, developing research capacity in the prevention and control of vaccine-preventable diseases. And fifth, increasing access to vaccines with assured quality and safety. And so, finally, when these issues have been addressed, we see that in many countries, especially low-middle income countries, the implementation of PCV in children is faced with these challenges. First, high vaccine cost of PCV, which is a major deterrent, especially in low-middle income countries. We see the lack of political advocacy and vaccine champions. When these are present, we see PCV being introduced early on, as in Pakistan and low middle income countries like Hong Kong, Singapore, Philippines, Thailand, Malaysia, and Malaysia in 2019, and most recently Indonesia early this year in 2020. The third is the paucity of surveillance data. Yes, surveillance is not easy to do in countries overburdened or with ineffective healthcare system. Competing health priorities is the fourth, especially in low-middle income countries where non-communicable diseases are sometimes given more priorities in healthcare. And then Dr. Memon, I remember, said serotype replacement. Is this a controversial issue, as many experts and decision makers continue to argue whether the benefits of introducing PCV in the National Immunization Program generally outweigh the small risk that serotype replacement can or may bring? So this is a major barrier? We hope not. And personally, I don't think so. We see here what countries in Southeast Asia reports as their mitigating factors to resolve the barriers for introduction of new vaccines in the National Immunization Program. We congratulate the great efforts done not just by government, but other healthcare workers, pediatricians who continuously engage the public and other healthcare workers to bring attention to PCV. We should say congratulations to Dr. Zulkifli Ismail, who is the Asia Pacific Pediatric Association Secretary General based in Malaysia, Dr. Daniel Goh from Singapore, and in Indonesia we have Dr. Cici Kartasasmita and Sri Hadinigoro. All are original founding members of ASAP for the marvelous job they have done for PCV. And before we end, let me focus our attention to another barrier to introduction of new vaccine. Disturbing as it may be, vaccine confidence has somehow been decreasing through the years because of adverse events following immunization of vaccine safety. Here is a map of the magnitude of vaccine confidence being shown in many areas of the world. Anti-vaxxer groups have emerged through the years. Take note that there seems to be a lower vaccine hesitancy in Asian countries and higher in the North Americas and Europe, represented by the pink color and darker color shades. The Philippines used to have a high vaccine confidence level in 2015, 93% to be exact. But unfortunate events overtook this in 2018 when the dengue vaccine was introduced. Fake news, disinformation, and political maneuverings brought down vaccine confidence to a low of 32%. This brought about confusion, chaos, with people losing trust in government health programs, especially vaccination. Vaccine coverage dropped to less than 50%, predictably resulting in deadly measles and polio outbreaks in the country in 2019. Thus, lack of adequate preparation and effective risk communication could pave the way for loss of vaccine confidence and delayed vaccine introduction of other new vaccines into the National Immunization Program. Many issues can be raised by policymakers and the public every time new vaccines will be included in NIP, and one must be ready to address them. It is worthwhile to say that with the COVID-19 pandemic, there is an opportunity to make people realize the value of vaccines and stop the anti-vaxxers in its tracks. Dr. Heidi Larsen, head of the Vaccine Confidence Project based at the London School of Hygiene and Tropical Diseases, reminds us that adequate risk communication and public perception of vaccines will be crucial in vaccine acceptance and uptake where we are. On another note, a recent survey we did showed that COVID has caused a decrease in immunization coverage in many Asian countries. And although some countries recovered almost immediately after a lockdown, others were not affected at all. Here we report on a short survey we did on the impact of COVID on immunization in Asia Pacific countries. In the beginning, almost all countries saw a reduction in immunization coverage. But many countries rebounded after the initial lockdown, including Taiwan. On the other hand, these countries, including Singapore, Korea, Thailand, Hong Kong, did not show any significant disruption and even continued their school-based program. And definitely, we saw how government support and extensive communication help countries to continue their immunization programs. It is remarkable, in fact, that when the pandemic began, Singapore decided to even increase the number of vaccines to be given to children, and government made PCV mandatory, including it as an essential vaccine beginning this November 2020. We must applaud Singapore. This is a strategy to decrease the incidence of pneumonia in children and reduce the anxiety from COVID. At this point, let me show you what should and could be the goal for a better vaccination program. And it is called vaccine resilience, defined as immunization programs that are able to withstand major shocks and disruptions, to quickly adapt to changing circumstances, and to maintain high vaccine uptake and acceptance over time. We believe that this is indeed the way to sustain and improve vaccine coverage and facilitate introduction of new vaccines. Ladies and gentlemen, the way forward are multifactorial. Three major and key factors are necessary for a resilient and sustainable vaccination program. And we can summarize this into the following. First, supportive and positive community and individual experiences. Second, an effective health system, adequate policies and program coordination. And third, government and stakeholders' leadership and commitment, and includes the private sector. Developing and forging partnership is the way to go. The absence of any of this could be a major barrier for introduction of not just PCV, but any new vaccine to be implemented in the national immunization program. Sharing best practices and learning from the experiences of other countries could bring about the changes that are needed. Let me end by stating that vaccination saves lives and is a major public health program which need our working together. For a well-spent and meaningful life, never be idle, but be reading, writing, praying, meditating, or endeavoring something for the public good. Thank you very much for your attention.